Welcome to another edition of I Am AAPC. Today I have Stephanie Vargason with me. Stephanie, how are you?
I'm good. How are you?
I am great, thanks. Stephanie and I met on or through Reddit. You're a Redditor.
hmm Yes.
All right. No,
I caved in and got an account, and I like to keep up on the community and see what's going on.
awesome. Well, there are so many communities on Reddit. And for those watching and may not know, there's a robust or growing medical coding and billing community and several communities around our industry. And I saw some posts from you there, and we kind of I reached out and we met through that. Stephanie, tell us a little bit about your story. How did you land in the revenue cycle of healthcare, and tell me about how that happened.
So we can go all the way back to when I was 18. I'll start at the very beginning.
Okay.
I'm 30 now. When I was 18, I started working as a pharmacy technician. I worked at Target in a little pharmacy here in Penfield, New York. And then I switched over to Strong Memorial Hospital, and I work in a psychiatric pharmacy. During that time, a couple months in after I got hired, I got severely ill. I was hospitalized. It was a very catastrophic medical event for me. But during that time, I actually found a surgeon who we will come back to that actually inspired me to get into coding. But I ended up taking a demotion and I worked in a call center for a cancer center. I learned a lot about hematology, oncology, and a lot about, e-record, Epic, things like that. After that, I went over to colorectal surgery, so I got a little bit more of experience there. And then I really wanted to work in plastic surgery because that was a surgeon that was on my case, and I really admired him and the work that he did. And once I started working for him, I started coding for prior authorizations and the surgeries that he would do. And soon, quite a few others in the office I would help along with their coding, and it just kind of became this natural evolution of something that I was good at and something that I loved. And I thought I should really just turn this into, a career and do something more, take this further. So my path was self-study. Um, I just was not able to be able to put myself into a position where I could take on paying for a course. But I was able to do self-study. There are a lot of great resources out there, and I love to stress that to anybody who feels like they're in the same position as well and to not get discouraged. So I self-studied for about 6 months, really hard. I was very lucky. I was able to also do it on the job since I worked kind of behind the scenes and at a desk. And when I felt like I was really ready, doing all the practice exams, I went and I passed my exam on the very first attempt, which was a huge milestone for me. And then about 4 or 5 months later, I was on LinkedIn and a recruiter reached out to me from my current company for risk adjustment. And that's where I've been for a couple of years now. And I just got my CRC in December, and that's where we are today.
Okay. You took us through a lot really quick,
Yeah.
and I want to really dig into a few things. So, um, your your path into that first job. So you were working as a coder before you're certified. Is that true?
Essentially, yeah. I mean, I was doing everything behind the scenes. I wasn't actually doing anything like production coding. Um, but working in plastics is really great because you work with so many other specialties on joint cases. I mean, we would work with just general surgery, neuro, pediatrics, transplant, colorectal. I mean, there's so many different things that you get to dabble in. And you get a really good understanding of the fundamentals of CPT coding, and how to use the book. And because we used the books in the office. So there was a lot that I was able to learn on my own. And, I was very fortunate being able to go through and learn about supporting documentation and finding out how to pick codes from what I was reviewing.
What was that job title, Stephanie?
So I was just like a surgical secretary. It was for
Okay.
a burn and plastic surgeon. And we saw a lot of diverse cases, and I really loved that position. We saw a lot of interesting things, and it gave me a lot of great experience. And I wouldn't take any of it back. Otherwise, I wouldn't be where I am, and I wouldn't be a coder, and I wouldn't have found, this great job that I really genuinely enjoy doing. So, sometimes they say everything happens for a reason, and it does.
That's awesome. That's so awesome.
Yeah.
The surgical um, sorry, it was a surgical assistant or secretary, surgical secretary.
Secretary,
Okay.
secretary. Yep.
When you applied for that job, did you have coding on your mind at all, or was it like just I love what this doctor does. I'm so inspired by them. I want to be a part of this.
Yes, that was what it was. I just really admired him and the work that he did. Obviously he changed my life, and it was just something that I really felt compelled to get into. And then it was maybe my first week on the job when the fellow secretary that was training me opened the CPT book for the very first time, and we had to code hidradenitis, and I had no idea what it was or what we were doing or
Yeah.
what I was looking for or about bundles, any of that. And that was really my first exposure.
Wow. Oh, what appealed to you about coding? As you're watching it, you're probably working close to coders. What drew you in to it?
I, I like that there are so many options, and being able to engage your brain and use, the experience that you have in order to pick the best code. And then when you get it right, you're just like, yes, that's it. That's the code. That's the one that I got. And there's something about being able to tell a story with just like a set of numbers and a set of letters. And I thought that was really interesting. And it's, I've always liked puzzles, and that's kind of what coding feels like for me, is just putting together a puzzle. So I do like that analytical aspect of coding. So I feel like the job really suits me well.
Okay. At what point did you learn about AAPC and realize you had to be certified, or would that would help your career?
Right. I started looking into programs like early 2022. Um, and that's when or late 2021, and then into 2022, I started studying and looking at the different certifications and realized that AAPC was the most prominent from what I could tell, especially within this region and the job postings, is that they wanted an AAPC credential. So that's the route that I chose. And, I'm happy that I did. I love AAPC. I love being part of the family. I serve on the local chapter. It's a great community to be a part of. But it was around that time when I realized, you do have to be certified in order to get any kind of coding job. And there might be some places that take you without it and will train you on the job, but most places will look for that, as you know.
I would love to hear more about that self-study process because I see that in the AAPC community. Sometimes someone will come in curious about getting into the field and wondering if they could create that study path by themselves. What did that look like for you?
Um, it was a lot of research on making sure that I had the tools that I needed. So my first advice is, if you can't afford AAPC, that's no fault of AAPCs. Some people just are not financially in a position to do that, and that's okay. But don't let that obstruct you from getting your certification. I knew that I could do it on my own. I was confident that I could do it on my own because I had such a long background of medical experience, and from being a type 1 diabetic, like, I'm very aware about things that are in the medical community and things that go on. So I was very in the know, I guess you could say. So I felt like it was something that I could easily accomplish without getting very stressed out. So if you think that you can do that, I suggest that you do it. If you're somebody that needs, a course or a live instructor, I believe there are places that can do that for you, and you should go that route if that's you feel like you need that. Otherwise, I think self-study is a great option if you're detail oriented and you can stay disciplined. My first step to doing that was ordering the book bundle from AAPC. And this is something that I recommend nobody, don't skimp on this. Don't order used books, order the current year. It's very important. Codes change every October. So it's very possible that a question on your exam might have a code that you do or don't have in the book that you're using. I also bought Buck's step-by-step coding from Amazon. You can rent it, which I thought was a great option. I didn't use the book in its entirety, but there were a lot of great things that it breaks down, and like insider tips and things like that I thought were really helpful. More like common knowledge, common sense type tips that I thought were really helpful while I was studying, and to get a feel for like what the real world would be like. I also watched Victoria, I think it's Vo now, Victoria
Yeah.
Vo.
Yep. Yep.
Yeah. Contempo Coding. I watched so many of her videos. I think she's an absolutely wonderful resource. There are so many things on there that she just that she goes over, and she goes over really in depth. And I just think that's so helpful that we have somebody out there that represents AAPC like that, to do these free videos for people to learn. I thought that was great. I also highly suggest being able to do the practice exam bundles, as many as you can, and just keep retaking them. And then I think once you score around an 80, I think you're in a good position to go ahead and schedule your exam if you feel you are as well. I also found something called ED to Go, if it's okay if I give that little plug. It was like a basics into ICD coding. And, I had the foundation for CPT coding, but I didn't really have the foundation very well for ICD coding and diagnosis coding. So I took that to kind of get my bearings on it. And that was also very helpful. There were certain areas that I was stuck on, mostly cardiac coding. Cardiac and vascular is
Not
notoriously
uncommon.
difficult, very, very difficult. Interventional radiology, all very difficult things. So there's something called Wisent. You can go on and you can find somebody who kind of specializes in that area, who is a coder, and you can ask them any questions if you need clarification. And I thought that was a great tool to be able to have. And if you're on a local chapter as well, even if you're not certified yet, if you know somebody who happens to work in that area, that's also a great option, is to reach out to them and get clarification on any questions that you might have. And that was really pretty much the bulk of how I did self-study. I practiced my timing. I know this sounds silly, but I listen to really fast music. I think there's some studies out there that say if you listen to video game music, you can actually work a little faster. So it helped. I increased my time a little bit, so that was good. And then I also highly recommend just getting familiar with your book, tabbing it the way that you want, highlight, note, annotate, really use it to your advantage, because it really is the most useful tool that you will bring into that exam.
Okay. So there are several sections. Like when you buy a course, it's going to take you through the sections that will appear on the exam.
Mhm.
You went into this because you didn't have this pre-structured course you're working from. So you're pulling from videos and a few books that you might have bought and
Yes.
pieced together your own course.
Yeah. Yeah,
Okay,
I did.
that's amazing. Awesome.
Yeah.
And the exam, at the time, you had the choice to take it in person through local chapter or electronically at home. What
Mhm.
option did you take, and how was that for you?
So I think it was June of 2022 that I took my exam, and I took it in person, which I highly recommend if you can do it. Um, I know that you can take them online. I've heard mixed reviews about being able to do that and how people do with that environment. I recently took my CRC, and that was at a testing center. And you can still bring your book and everything like that. But personally, for me, I prefer to be able to lay everything out, and I liked having that, the pencil, and being able to write out my thoughts and the codes that I wanted to choose or didn't want. And that was a format that I thought would be best for me. And of course, it's something that varies by individual.
Yeah. Okay. I want to talk a little bit more about finding that first job because you see that, in the communities that you're in, that is a challenge for some members. It's not impossible, and I often say, hey, just open up that door and get any position you can within a healthcare administrative office.
Right.
And you were already there. Take us, give me a little more insight on how you found that first job. So you were working as the surgical secretary. You take
Yep.
your course, you post on LinkedIn your job, or that you had your certification, and then a recruiter found
Mhm.
you. Did I get that right?
Yeah, pretty much. Yes. So when we're going over tools and helpful things, I did use Project Resume, and I think that is a huge help. So anybody who is any kind of coder, whether you have your apprenticeship or not, just go to Project Resume. They do a beautiful job, a wonderful job, very affordable. And they put everything on there that you really need to have, that you've, put in your toolbox. So I think that's a great starting point when you're going, getting ready to look for a job. Um, I was very fortunate that I had a couple of managers and a surgeon who were very supportive and wrote me a supporting letter in order to get my apprenticeship status removed. So I went into the market as a CPC without the A. And I think that's probably uncommon. I just had a great situation. I was just very blessed and things just really aligned for me. I don't think that happens for a lot of people that are in these positions, but I do want to say don't get discouraged when you see people who want CPCs and they don't want the apprenticeship status. My point of view is that at that point, you're malleable, you're flexible, you're willing to learn new policies, how they do things. You're not bringing old viewpoints with you of this is how we used to do it. You're learning what they want you to learn. And I think a lot of employers find that very desirable. So, if anybody is, apprehensive about being a CPCA and trying to find a job, really use that to your advantage and play to your soft skills. When I first started looking for jobs, I applied to maybe 20, 25, which from what I read on Reddit is really not a lot compared to what people are doing today. I'm seeing people doing 100 to 200 applications. And I didn't get responses from any of the ones that I put in, or I got those automatic rejection letters. By chance, I just decided to make a LinkedIn and I had a recruiter reach out to me and everything just kind of fell into place. I had my interview. It went very well. They were very interested in the soft skills. We can teach you about risk adjustment, and that was great. And they're a very supportive team. Everybody is very welcoming and open-minded and supportive in each other's coding, which I think is really invaluable.
If I am a new CPCA, or if I'm a student, I would be searching for any job right away that's
Yeah,
within the office. And you could create a path similar to yours, build relationships with a manager if you're a surgical assistant or whatever it may be.
right. Yeah, you can. I think if you are just looking to get your foot in the door, you really want to get started, I would say take whatever job that you can get. Um, that may not be, people want to hold out for that perfect position, and not everybody gets that. And I think once you kind of accept that and you just apply for anything that you think could be relevant or put your certification or get you some sort of experience under your belt, I think go for it. And then after 2 years, once you've, got a good foundation and you have some understanding and maybe you are able to get your apprenticeship removed, I think that will open more doors for you. I know it's very hard when people post entry level positions, but they want 5 years experience because then it's not really an entry level position. And I think that's where a lot of frustration lies with new coders and the discouragement that just kind of settles in and you can't get rid of when you're looking for those positions. But they are out there. You just have to be persistent. And, I do think it is who you know. I think networking is a great tool for you to be able to do. So go to those local chapters. Virtual meetings, you can go to any virtual meeting. It doesn't have to be within your area, it can be virtual, and just get to know people. And, if you reach out to them and say, hey, let me know if you have anything. Let me know if you're looking for a new coder or somebody, that, might be beneficial to having me on the team, like let me know. I think that's a really probably your best way of getting a new job as a CPC.
Okay. And I love that you brought up local chapters. You're a local chapter officer. What position do you hold in your chapter, Stephanie?
I am the secretary. Secretary things are my jam. I love doing spreadsheets and data and things like that, and being able to organize and do forms and make things easier for everybody and things like that. So I've been on it for 3 years now, and I do love my position and everybody that's on my team there as well.
And I think if a student coder, someone trying to break into the industry and maybe just studying at this time, they might be nervous about going into a local chapter with all of these veteran coders. You're going into the unfamiliar. What advice would you give to that person? We're talking to that person just barely starting their path right now
Right.
and building those relationships. What advice would you have for them and how to utilize their local chapter?
Just jump into it. Don't overthink it. just jump into it. I can tell you from when I do CEUs and see who's attended the virtual meetings, and when I plug in those names and member numbers, sometimes there aren't member numbers, and I recognize some names that are just hospital administrators. So there are people on there that aren't coders at all. So you being there and it just to absorb that knowledge, or see whoever is presenting, just be there, take it in, whether you get the credits or not, or it applies to you or not. Like it's just good to be exposed to whatever presentations are happening. So, and if there's something that really does pique your interest, you can search for that topic within AAPC, or you can even ask your local chapter and say, hey, I wonder if we can do a presentation on this, and we will try to find something and see if we can find somebody to represent that specific discipline, which I think
Yes.
is really nice. Yeah.
Okay. And since you had experience being around coders before actually working in coding, did your first role as a coder live up to what you thought it would be? And has it been worth it?
Yes. So I actually wasn't working with other coders. I just happened to be the person in the office that was really good at coding. And so usually it was the surgeons that would give you the CPT codes that they wanted to use. And it was kind of like, you know, here's like 10 different CPT codes that we could be using. We don't know for sure, but go ahead and get the authorization. And so that was kind of what I was doing, was scanning the book and going through and seeing what could possibly apply to this surgical scenario. And then I would get the authorization. But this is my first job doing production coding and being with other coders, and it's been really, really wonderful. I think it might be somewhat highly unusual with the way that we communicate with each other, because it is so positive and so supportive. And being able to read something and say, this is how I read it, and someone else saying, that's not how I read it. I read it this way instead. And then you think, I didn't even think of it like that. That's such a good point. And so being able to see these other perspectives is really interesting when you begin working with other coders and seeing, their explanation behind things, or why they chose this code instead of that code, and having friendly disagreements, and then just learning from each other. And that's something that's really special about where I work at Excelis. And it is a major health insurance company. I don't know how many other people can get to say that, but I really do love my job. I work from home. I'm very lucky. Um, I get along with everybody on my team. I love my managers. They make sure that your well-being and mental health is taken care of. So there are dream jobs out there. I was not expecting to get my dream job, but I did.
That's awesome. That's so great to hear.
Yeah. Yeah.
And you have your CRC, which makes me wonder, in your few years in this career, have you had the same role?
I have.
Okay.
Yep,
And
I
why
have.
the CRC now?
So the CRC was just part of the requirement, is after you
Okay.
get hired as a risk adjustment coder, you do need to get your CRC. So I went ahead and got that. And I had wanted to get another certification for quite a while. I was actually looking into, or I was trying to study for the inpatient coder, but I found that personally exceedingly difficult. So kudos to anybody who is able to do it. I was only familiar with ICD-10-CM and CPT, and then the ICD-10-PCS is a whole different language, which I was not expecting. And, the same terms mean different things. It's very complex. So again, kudos to anybody who is able to do that. But, I think get your core certification first, your CPC, and then, get into a field and see if you have a feeling for something in particular that you find really interesting, and go that route and see if you can get certified in it. If I had stayed at surgery any longer, I probably would have gotten certified in either dermatology or just general surgery.
Okay. Awesome. Well, Stephanie, I loved hearing your story. I'm curious. I ask all of our guests this.
Mhm.
When you're not coding, what do you do? How do you unwind from work?
Um, I'm pretty introverted. And I like to be alone a lot and have a lot of restorative time. I have three Persian cats and an English bulldog, and they fill our house. So in the downtime, I'm with them and probably just, watching some TV and doing puzzles, or diamond painting is a fun little hobby. So I know a lot of coders that actually diamond paint. It seems to be like a theme among us. If you're really good with details and things like that, I think anybody who's a coder might actually find diamond painting really enjoyable.
Awesome. Well, I'm surprised you
Yeah.
said you're an introvert because I don't get that feeling from you. You seem a natural speaker. speaker.
Thank you. Well, so because of what happened to me, it was almost 10 years ago now. It'll be 10 years in July. Because I got so sick and it was a very special case. I was on something called ECMO, which is extracorporeal membrane oxygenation. It's a heart and lung bypass machine that wasn't really used at that time, back in 2015. Um, I was very young. I was 20 and I made it when I shouldn't have. And there's not a lot of people that are like me in that sense, that went through something like that and were able to come out the other side. And so I saw it as an opportunity to really give back to the medical community and the providers that treated me and other patients or families that might find themselves in a similar situation, to give the patient experience and just provide them what it was like for me, what my healing process was like, what I went through, just mental health, things like that, things that I experienced in the hospital that didn't make sense to me, that I thought that they could change, and there have been some changes that were implemented. So, I find it really, really empowering to be able to speak about something that people want to hear about. So when I do any type of public speaking or interview, I don't really get nervous because they want to hear what you have to say. And so I think as long as you carry that with you and you remind yourself, I think you're able to get through this kind of interview very easily.
Yes. Well, awesome.
Yeah.
Thanks so much for sharing,
Yeah.
Stephanie. I appreciate it, and I'm
Yeah.
sure your story will inspire others.
I hope so. Thank you.